Try these common sense strategies to lose weight. Hello and welcome to the channel. Just 2 days ago, I reviewed a patient who had undergone a stomach bypass operation as a means to lose weight. She had come for a review of her blood tests, which she had had a few days prior. Now, may I just let you in on a little secret? I may be crucified for this, lynched, lambasted, teased mercilessly, and excommunicated, but I shall still let the cat out of the bag. Just for the love of you, dear viewers and listeners. The big secret is, your doctor actually likes you. Yes, that's right, I said it. And if you don't hear from me for a while, please call the police, because it would mean they got to me. I'm kidding, I jest. But in all seriousness, hear me out. Now, I shall drop a video on Dr. Archetypes shortly, so you get the other side of the story of the patient archetypes videos I have dropped so far, here, and even these are not exhaustive. I shall certainly send you a further video on even more patient archetypes in the near future. I have mentioned before that medicine is never one of those professions which can get boring. This is very true. No one day is quite like the next. But of course, like all jobs, it can get a bit humdrum, meaning monotonous routine, just never boring. As a patient, it may seem like you are a statistic, a number to your doctor. Not so in many cases. Let me tell you why. No matter how money motivated your doctor is, and let me preface this by stating that medicine is certainly not the money spinner profession it is perceived to be. When you understand that ex-doctors like Ali Abdal and his now wife Izzy Steely quickly did their calculation and realized that they could earn more than 5 times their medical salary on YouTube alone, that should tell you something. I say good on them. At best, medicine offers a comfortable middle-class life, nothing more. So, no matter how money-oriented your doctor is, and especially if he or she has stuck with it for a long time, 10 years plus, especially if they are in a field like general practice, for example, the fact is they are in your life, whether they like it or not. They are where they are. You start growing on them, whether it is intentional or not. They are in your life, however they ended up there. You are stuck with them, and they are stuck with you. When your new baby is born, they rejoice with you. They may even come to the baptism. When your dad dies at the age of 89, they mourn with you. They may even come to the funeral. When your teenage daughter or son passes a major exam, they celebrate with you. When you get the all clear from your cancer specialist, they hug you in joy. When you lose a ton of weight, they are pleased for you. The latter happened to me a couple of days ago. This lady was the exact opposite of a tornado. If you don't know what I call a tornado, look at this video quickly now. She was what I call a quiet mouse, a wallflower, lack of self-confidence, full of self-consciousness, apologetic just for occupying space. Yes, apologetic just for being. A lovely lady with a refreshingly bright and easygoing personality once you broke through her million barriers to get to know her, which I have had to do, by the way, over the years, just to understand her and tailor my care of her appropriately to her needs. She was unfortunately not the easiest on the eye before her bariatric or weight loss surgery. She had red, puffy skin, unflattering hairstyle, no doubt deliberately done to deflect the male gaze. Mr. Magoo thick-rimmed glasses that came right out of the 60s. You get the idea. Seeing the same lady presently, a few weeks after her surgery, with her beautifully proportioned body, which for the first time since she was a teenager included an actual waist, a new hairstyle, glowing skin, and a new walk that I never thought possible for her, I couldn't help but be so happy for her. She revealed that her sleep apnea had gone. She had to return her breathing machine back to the supplier. Yay! She could actually run for a bus if she was late. And best of all, she was feeling confident in herself, a feeling she had never ever felt in her entire life before. In her quiet and reflective manner, she let me know that her stomach bypass operation was basically her best ever decision that she had taken in her entire life. And it had helped her, saved her life even, in more ways than I would ever know. I believe her when she says that. For me, it's not the first time, of course, that I witness massive weight loss in a patient of mine. These days, it is mostly post-op, but occasionally I have people coming in for a weigh-in that I have personally threatened or they have come to their own conclusion that it is the only way forward and have it done all by themselves, the weight loss, or sometimes through Weight Watchers or some other such program. I have always had a congratulatory word for such people. It is always courageous to change the personal narrative and go get the desired goal for yourself, with or without the doctor's help. No matter how sang-froid or cold-blooded your doctor is, they will be appreciative of your steps towards better health for yourself. That would be one less heart attack in 10 years for them to treat. How's that for a statistic? Here's another trade secret, this time a personal one, which is I am not a fan of bariatric surgery, actually, because I believe most people can lose weight successfully without the aid of a surgeon's knife. It is, however, nice to know that this option exists if all other attempts fail, as indeed with my patient. This video is all about some common sense strategies one can deploy on the journey towards better health and long-standing weight loss. Strategies I have not mentioned before on this channel, and which I also don't find on other channels, maybe because they are so simple, so basic, that no one thinks they are worth mentioning. But indeed they are. So here goes. Let's dive in. The first one is a liquid diet. No, I don't mean alcohol consumption. Instinctively, we all know that this strategy actually works. When you are sick with flu and stuck in bed all day and can only manage liquids, you emerge 2 weeks later with a 5-kilogram weight loss. What happened? I will tell you. First, you lost a ton of fluid through your sweat. This is what we call in the business insensible fluid loss. When, as a patient, for example, after surgical operation, you get a drip of saline solution or water that you have to annoyingly drag everywhere with you, including to the toilet, your surgeon or doctor has calculated how much intake of fluids you are taking in, how much is coming out of you, and this is why your nurse wants to know how much you are peeing, pooing, and drinking, and she comes in to record your inputs and outputs every hour, and you think she's just being a nosy so-and-so. It is factored into these strips how much you are also losing, but which is not measurable. When you lose more total body water, as we call it, than you put in, you lose water weight. This is the quickest type of weight loss you can effectuate. When water weight loss occurs over a few weeks as opposed to days, you start to lose fat as well. You start to lose fat weight, which is the desired goal. In effect, after most major operations, especially bowel operations, where it is necessary to rest the digestive tract for a while, you cannot put in solid fluid, or solid food, I should say. So, liquid diet is all you can have. This commonly leads to at least a transient weight loss. The same can be said of people undergoing specific types of treatments like chemotherapy, immune therapy, radiotherapy, where nausea and vomiting are high on the list of side effects, such that artificial forms of feeding may even become necessary, like a nasogastric tube, a feeding tube fed through the nose into the stomach, or even a more permanent tube called a PEG tube, a percutaneous endogastric tube, or another one, also a permanent one, called a jejunostomy tube, where a tube is funneled in through the skin of the tummy into the small intestine. With these feeding strategies, solid food is out of the question. So you are left with liquid food, which is often packed with calories. But even so, the net calorific intake is still often negative, meaning you lose more than you gain. Just to breathe, talk, urinate, and poo takes a lot of energy, even when you are bedbound. And all this expended energy needs to be replaced in the form of calories, let alone for someone who is up and about, living a normal life outside of a hospital bed. Switching to warm soups and hot drinks, especially in the autumn and winter months, so round about now, with occasional solid foods like meat, pulses, beans, lentils, and chopped vegetables can simulate a similar weight loss. Semi-solid foods like mashed potatoes, polenta, semolina, and porridge also work well in this context. Adopting this kind of regime for a few days or weeks at a time is beneficial to the body because it rests the digestive tract, especially the liver and pancreas, which must work overtime to produce the necessary accessories to digestion, all the enzymes required to break down proteins, fats, carbohydrates, vegetables, etc. This is why in every religion there is always a period of fasting, or at least reduced solid food intake. And the concept of bread and water fasting is also within the same vein, all designed to give your tummy a rest for a little while. If you have ever joined Weight Watchers or similar weight loss plans, you will know that you get a liquid diet as part of the plan. Voila! The reason for this is exactly what I have just described. The other reason is a liquid diet helps to shrink your stomach faster than eating smaller quantities of solid food, which is kind of similar in effect to a stomach bypass operation, mechanically speaking. By the way, intermittent fasting also has this effect, since you increasingly get used to going for long periods of time without eating. Therefore, your stomach capacity starts to shrink accordingly. It's all common sense when you think deeply about it. Another very practical and common sense tactic is to satisfy our need to do something with our mouths. That is nothing to do with hunger. Let me explain. When I try to convince my smoking patients to quit smoking, I often get the retort, well then, what do I do with my hands? Giving up something like smoking, alcohol, and drugs is all about managing the side habits as well as the thing itself that you were trying to give up. With alcohol and smoking, it is about what comes naturally when you are in a pub with friends and family. What? No pint? No fag? Impossible to successfully quit smoking and alcohol and to go sit in a pub on a Friday night where all your friends and family around you are smoking and drinking. To successfully quit, you would also have to manage your social life, take yourself away from the environment, which is highly tempting. Same with food intake reduction strategies. Sometimes it is not the case that we want to actually eat or that we are hungry. We just want to move our teeth and mouth. If you become aware of this tendency, good. Why not deal with the urge to move your mouth, to move your teeth? Why not buy a sugar-free chewing gum? Dentists will tell you that chewing gum is actually good because protective saliva is released, which combats bad breath, prevents tooth decay, whitens teeth, and promotes stress relief, not to talk about strengthens your jawline to a small degree. In this way, you satisfy your need to do something with your mouth, chew, but you don't put in calories. It's a win-win situation. My next strategy is frequent abdominal exercises, so-called abdo crunches, which help to keep it all in, so to speak, and help build the abdominal wall, which has in effect two goals or two benefits. One is by dint of keeping the abdominal wall strengthened, you reduce the capacity for your stomach to expand out of control. Number two, you lose belly fat by building muscle around your abdominal cage. The advice, at least to young women of finishing schools, of which Switzerland, of course, is a well-known prime location for finishing schools, of hold your tummy in, comes from this mindset. If one develops this habit lifelong, one can effectively stave off belly fat for a long time, say well into your 60s. It's simply a good habit to hold your tummy muscles in. It's a very, very effective weight loss strategy. Finally, I have one last tip. At first glance, it seems far-fetched that this strategy works, but I have done my research into this and tested it out on myself. I do suffer for my art. My final strategy in this video is, drumroll, pepper. Yes, the hot stuff, pepper. I first stumbled on the possible weight loss benefits of pepper when I researched its pain relief properties. I noted that it causes a pyretic effect, burns your mouth, and gives you a diarrhea effect. So, something that makes you sweat and gives you diarrhea. That's total body water loss right there, I thought to myself. I looked deeper into this. Then it all spilled out and I haven't looked back since. Here is what I found out about the lowly hot pepper and how it can help you lose weight. The active ingredient in peppers is called capsaicin. And let me tell you that capsaicin is a molecule, a substance that has been widely studied in the field of research medicine. Capsaicin, or scientific name 8-methyl-N-vanillyl-6-nonenamide, is a lipophilic compound. It's a fat-loving compound classified as an alkaloid, so the opposite of an acid. It is a compound that interacts with the transient receptor potential vanilloid subtype 1, a receptor expressed in sensory neurons, nerves basically, and various tissues. Full name TRPV1, transient receptor potential vanilloid subtype 1. TRPV1 activation induces sensations of heat and pain, but it also triggers a cascade of physiological responses that influence metabolism. Are you paying attention? Metabolism. That's weight loss right there. Capsaicin's bioavailability, its availability basically in the bloodstream, varies depending on its form of administration. Either it's swallowed, it's injected, it's infused, form of administration, how you give the medicine. But it is generally absorbed in the gastrointestinal tract. It undergoes metabolism primarily in the liver, where it is converted into simpler compounds that exert various biological effects, which I shall explain now. One of the most well-documented effects of capsaicin is its ability to promote thermogenesis, the process of heat production in organisms. Well, we all know that. Anyone who tries a bit of pepper will definitely find out very quickly about this thermogenesis effect. By activating TRPV1, capsaicin stimulates sympathetic nervous system activity, your fight and flight activity, leading to an increase in energy expenditure. This effect occurs through brown adipose tissue activation. Now, in a previous video, I promised to go into brown and white adipose tissue. I will still keep my promise. Watch this space. Capsaicin induces the activation of brown adipose tissue, a specialized tissue that burns calories to produce heat. In humans, brown adipose tissue activation is associated with a higher metabolic rate and reduced adiposity. You can lose weight by activating your brown adipose tissue. Fact, scientific fact, as it turns out. Increased resting energy expenditure is also an effect of capsaicin supplementation. By this, I mean that the resting metabolic rate increases. So even without you running a marathon, your body's metabolism increases at rest when you're sitting, lying down, not doing much. Your calorie burning capacity is up without you having to put in the effort. How cool is that? And guess what else capsaicin does? Capsaicin has been shown to modulate appetite, so change your appetite, and reduce caloric intake by causing you to feel full faster because it influences gut-brain signaling pathways that regulate hunger and satiety, possibly through the release of appetite-regulating hormones like glucagon-like peptide 1, GLP-1. Now, where have you heard that before? Where have you heard of GLP-1 before? Yes, that's the receptor that is targeted by none other than these new weight loss inducing diabetic treatments or injections. Wegovy, Saxenda, and Ozempic. This is exactly what these injections do. You can get the same effect with capsaicin, the common pepper. Reduction in cravings. Regular consumption of capsaicin-rich foods, pepper, has been linked to reduced cravings for fatty and sugary foods, making it easier to adhere to a calorie-restricted diet. Touché. See how this works? You can do things the natural, simple way or the expensive, artificial way. Pick one. Fat oxidation and lipid metabolism. Capsaicin also plays a role in promoting fat oxidation, the process of breaking down fat molecules to generate energy, through two mechanisms. One is enhanced lipolysis, and this is where capsaicin increases the breakdown of stored triglycerides, specific fat molecules, into free fatty acids and glycerol, which can then be oxidized for energy, or suppress the activity of enzymes involved in lipogenesis, fat synthesis, fat building, thereby reducing fat accumulation. So it either promotes fat breakdown or it inhibits or reduces fat building. Capsaicin also has anti-inflammatory effects. Now, I have also mentioned in the past that with fat increase, obesity, comes inflammation, which is strictly toxic to the body and which is often very swiftly followed by a metabolic consequence like atherosclerotic effects, strokes and heart attacks, and also cancers, oncological effects. Capsaicin has anti-inflammatory functions by downregulating expression of cytokines. So cytokines are immune messengers. They talk to each other within the system, within the immune system, to either do some damage, or if they get controlled by the immune modulators, they become under control, and the body can then use these to actually do some good. It depends on which of the good factors you have and which of the bad factors accumulate. Specifically, capsaicin downregulates the expression of cytokines like TNF-alpha and interleukin-6, which are associated with obesity-induced inflammation. If you've watched some of my previous videos, you would know that I always go into these two cytokines, TNF-alpha and interleukin-6. Not least because interleukin-6 is one of those interleukins which is named after the city of Interlaken in Switzerland, which is where I am based. Now, there is another effect of capsaicin which is interesting because this is a much more direct effect on weight loss, and that is it improves insulin sensitivity, or to put it another way, it reduces insulin resistance. Now we know, at least if you've been watching my previous videos, you would know this, that insulin resistance is one of the bases of diabetes in adults. Emerging research indicates that capsaicin may positively influence the gut microbiome, which plays a critical role in energy balance and fat storage. Supplementation with capsaicin has been shown to increase the abundance of beneficial bacteria like bifidobacterium and lactobacillus, and also decrease the prevalence of obesogenic microbes, thereby reducing systemic inflammation and improving metabolic health. Potential applications of capsaicin in obesity management is quite the news of the day. I didn't know this, but in my research, I have found that there are weight loss supplements coming out which have the active ingredient capsaicin or its analog Capsaicin. And these are used to enhance fat oxidation and suppress appetite. Capsaicin is also being used increasingly as incorporated molecules into functional foods like fortified snacks or beverages, and these offer a practical approach to delivering anti-obesity benefits other than putting them in tablets or presenting them as medicines, which of course some people are not particularly fond of, are not a fan of. Now, the idea of fortified foods is actually not new to medicine. For example, we know that a lot of milk and cheese products are fortified with calcium and vitamin D, for example, especially in areas where children have poor access to sunlight, in northern temperate climates, for example. And also, we know that cereals are fortified with folic acid in certain countries to enable the young women of childbearing age to never experience population-based folic acid deficiency, because we know that a deficiency of folic acid can result in babies being born with spina bifida. So the idea of fortified foods is not new. So capsaicin is one of those that is being used for this purpose. Of course, there is also research into using capsaicin as actual medications, as a weight loss medication, as I've already discussed previously. And this is with the aim of introducing them into or being incorporated into weight loss programs. So that's all very exciting. The problem with capsaicin is that it has a lot of side effects, as you would know if you ate a lot of peppers. These include nausea, heartburn, and diarrhea. So in order for capsaicin-containing supplements to be safely used or to be incorporated into medication would take quite a little bit of tricky maneuvering to ensure that the final product is safe. So watch this space. To be honest, personally, I am not at all interested in the capsaicin, either functional foods or tablets, what have you. I am more invested in the natural product. Unless you have a gut problem preventing you from consuming peppers and spicy foods in general. So, for example, like gastric ulcers, gastritis, stomach inflammation, colitis, gut inflammation, Crohn's disease, ulcerative colitis, and such illnesses, you could actually try incorporating peppers into your diet, hopefully in a creative manner. And obviously keep it sensible. Don't try the hottest peppers in your first go. There is a graduation scale of peppers. Do your research. Start with the gentlest ones and stay with the ones that you can tolerate. Never exceed your limit and risk burns to your mouth and gut. Stay safe in your pepper regime if you do decide to try it as an option for weight reduction and a health regime in general. As we know, it's not just about weight loss, but also inflammation reduction and so many other beneficial properties that we can expect from a diet rich in pepper. Needless to say, the age-old strategies for weight loss, like regular exercise, intermittent fasting, and avoidance of sugar, are all to be adhered to in combination with the common sense strategies I list in this video. The gradual increase in energy, the sense of feeling lighter and healthier are all their own reward, even before the bigger prize of actual objective weight loss that can be evidenced on a scale, on a weight scale. Are you going to try any of the strategies I've mentioned in this video? Are you brave enough to try the last one? Let me know your thoughts. Ask me anything on this or any other subject matter in the vast field of medicine. Go for it. Askadoc.